Well, nurses at Kapiolani Medical Center for Women and Children held a demonstration today as frustration continues to grow over stalled contract negotiations.
As our Kristen Concilio reports, more nurses will soon be at the negotiating table.
In a few days, almost 2,000 Oahu nurses will be starting contract negotiations as bargaining continues for 600 of their colleagues at Kapiolani Medical Center.
That's the scary part. Like now you have another big hospital, Queens, coming down the road, and there's more nurses there, and they're going to have the same issues as well.
The Hawaii Nurses Association claims nurses are overworked and that there could be a looming crisis if more start leaving the workforce.
When they're burnt out, they don't want to come to work, or they leave the workplace, and that's what we're trying to prevent. We want to keep the nurses here, especially our local nurses.
The Queens Medical Center is starting contract negotiations on April 9th for about 1,900 nurses whose contract expires in June. On Kauai, more nurses at Wilcox Medical Center will also begin bargaining in the next few weeks.
It's very critical.
The Healthcare Association of Hawaii says one of the reasons nurses have been working so hard is because of a record number of patients, but that has come down in the last few months.
When you drop 100 patients a day, that means you need less nurses per day, which means there's less pressure on overtime, there's less pressure on double shifts. And one of the things that is happening also is that we are now less reliant on travelers.
And hospitals are working hard to recruit and retain nurses as healthcare shortages abound across the industry.
Just like every hospital across the country, there are challenges, but we have been successful in recruiting and retaining.
The hospital group says investments in recruitment is slowly coming to fruition.
So we have a slightly increased labor pool. Now we still have shortages. We need more nurses, we need more CNAs, we need more LPNs, but we definitely, all these training initiatives, all this investment in the healthcare workforce is definitely paying off.
At Kapiolani, a federal mediator is now involved in negotiations. Kristen Concilio, Island News.